a week or so before my menstrual cycle, I would begin having like morning cramps to the point where I was like, I can't go to work. I can't be at work all day in this amount of pain. I mean, I was having literally a cycle that was lasting 10 days. I would start out using like just regular protection, then I was doubling up on protection because the blood was just coming too fast to where I was like, do I need to go to urgent care? And it wasn't like pain in the morning, it was pain all day long, and it was consistent. I would go through the pain, have my cycle for 10 days, be off maybe a week, and then start all over again.
Karen came to me on advice of her sister who had a similar procedure done not more than 6 months prior. And Karen's problems were very similar to her sister's as well. Fibroids and pain and bleeding that she was looking for an effective, minimally invasive option. It
was to the point where it was affecting my life. Like I don't want to go out, I don't want to hang out with anyone. I was tired all the time, so I was like, I have to do something with this. So then that's when we start discussing several options.
Karen is a very active, young, healthy lady and was very interested in preserving her ability to get back to her normal activities. So she was the perfect patient to want to pursue a minimally invasive option. I think Karen's biggest complaint was the pain and the pressure, and effectively removing the fibroids and most of the uterus, as well as taking down some of the scar tissue, immediately resolved those problems. The use of robotic surgery allowed us to negotiate the scar tissue and treat the scar tissue, and allowing us to complete the procedure.
Well, when I woke up, I mean, I was just like, wow, this is a new start.
She was very pleasantly surprised that she felt so good so quickly.
Surgery was minimal. How do you say this? The pain was gone. I did have to stay 1 day, but it wasn't like 3-4 days as the other surgery. This was the first month where I was like, wow, I didn't have a menstrual cycle. I didn't have any pain. I didn't have any bloating. I didn't have any of that. Plus, I feel better about myself. I mean, I feel like I want to dress better. I carry myself better. You know, just the whole day feels a lot better. And I was like, yes, no more, no more. I have 2 daughters, and we very active together now. We go to the gym together. We talk all the time now. Like, they'll come in my room and now it's like they feel comfortable coming, like, we can go sit in mom's room and talk to her. We can sit up and have conversations, watch TV. Before it was like, get out of here. I don't want to be bothered. Leave me alone. I think my daughter's like, yeah, this is the best thing to happen to her.